Okay,
Don't worry about it.
Okay, so hey guys, so Kyle, Austin, and I are going to be presenting on Legg, Calve, Perthes disease today. And so Legg, Calve, Perthes disease is also called Perthes disease, is considered a rare disease only occurring in about 1 out of 1,200 children. This condition will occur during childhood when the blood supply to the femoral head of the hip is temporarily disrupted, causing bone death. And this bone death is called osteonecrosis. And we just learned about this in our chapter 17 lecture as well. The weakened bone can begin to break apart and lose its round shape once it's healed, which can cause pain and stiffness. A repeated pattern of this bone death, fracture, and renewal can occur for several years for someone with this disease. This is also most commonly found unilaterally rather than bilaterally, with less than 5% of children being affected in both of their hips. So some causes, the disease is caused by a lack of blood supply to the femoral head of the hip joint. From this lack of blood supply, the bone becomes weakened and has the risk to break more easily and heal poorly. Although the exact cause of the temporary disruption of blood flow to the femoral head is still unknown. Some risk factors are age. This disease will most commonly affect children between ages of 4 and 10. A child's gender is another risk factor, in which this disease is 5 times more common in boys than girls. Race is yet another risk factor, in which this disease is more commonly found to occur in Caucasians, Asians, and Eskimos than in African Americans, Native Americans, and Polynesians. Extremely active children could be another risk factor as well. Also, it has been noted that exposure to secondhand smoke may also increase a child's risk of Perthes disease. There also appears to be a link to mutations in specific genes that may increase a child's risk of Perthes disease as well.
Some of the symptoms found in Perthes disease include stiffness in the hip, as well as limiting hip movements. Knee pain is very common, as well as any lower extremity range of motion limitations. Thigh or groin pain that typically does not go away after a small amount of time or just sitting in one spot. You'll see shortening of the leg or both legs, and causing an equal length between the two of them. One will be longer than the other, and a loss of muscle in the upper thigh. So the 3 common ways to diagnose Perthes disease include X-ray, bone scans, and MRIs. You can see in each one, the arrow points to where you'll see some problems. A lot of these you'll see one side of the hip has it while the other one doesn't. These arrows will typically point to area of degeneration or degeneration and or some loosening of the hip joint. You could see typically in the bone scan, there'll be a higher density of the darkness where you'll find the Perthes disease, not because of a stronger compact of bone, but because there's a lack of bone, and it will be filled typically with fluid or blood. Some of the epidemiology of Perthes disease, this study was conducted in the UK, includes around 5.5 children out of 100,000 children are annually diagnosed with Legg Perthes disease. Boys are typically 3 to 5 times more likely to be diagnosed with Perthes disease than girls. Typically, the average age of diagnoses with this disease is from 3 years old to 12 years old. Typically, this diagnosis range does not see past age 14 because it either already been diagnosed or the parents don't feel like getting it diagnosed for their child. And another big risk factor is, of course, secondhand tobacco smoke exposure. but a lot of these cases are due to genetic predisposition for the disease, causing an increased risk of it.
All right, so treatments for Perthes disease will vary typically depending on the age, the age of the individual, the stage of the disease, or the amount of damage to the hip itself. During healing, the acetabellum or the hip socket can be used as a mold for the femoral head to retain and regain its rounded shape. Some cases will require surgery to keep the femoral head snug in the hip socket, while others may just take some rest and take some weight bearing away from the extremity. So a lot of times it's broken up into the age of the individual. So in children younger than 6, most don't actually require surgery for Perthes disease. The socket of the hip is naturally a little bit more moldable, so the acetabellum and the femoral head will fit and stay together a little bit more easily. As the kids get a little older, so between 6 and 8, the disease has kind of progressed a little bit more, so some more invasive techniques may need to be used. So a hip adductor tenectomy is usually done, followed by casting of the hip. So some of the adductor muscles will actually be severed so that we can put the hip into a better position. And then the cast will be done on the hip and the leg. And the cast will be spread the legs wide apart with a bar in the middle of them for about 4 to 6 weeks. This type of casting is called a Petri cast. So this position is supposed to help increase the hip joint mobility and also decrease inflammation within the hip. Now, as they get a little bit older to be diagnosed with the disease, so there might have to be even a little more invasive types of surgery. So from 8 and up, a hip joint distraction with an external fixator is used often. So this is going to require a longer recovery because the bones in the hip are actually pulled apart and then repositioned. And then the external fixator can be applied and adjusted to allow varying degrees of range of motion as the healing progresses. A femoral or pelvic osteotomy is also common. So part of the femoral head or the acetabellum will be shaved away and then put back together. Plates and screws internally are generally used in this type of technique. So the picture that I have here is for the hip joint distraction, and there's an external fixator in that one. So some non-invasive types of therapy, so more physical therapy interventions can also be used, sometimes without surgery, other times after surgery, after casting is done. So definitely activity restrictions are needed in this situation. So no running or jumping activities, anything to take some weight bearing off of the hip. Crutches are also used a lot of times to get either partial or non-weight bearing on affected hip. So after casting or any other healing is done, strengthening and passive range of motion exercises need to be done to gain strength back to the area and flexibility. So some exercises for strengthening, they can do a prone hip extension with a hold, something called a fire hydrant, which is basically a hip abduction in an all fours position. Scissor lifts, which is a side lying hip abduction, and then single leg bridges or double leg bridges with holds are also done. And then for the passive range of motion stuff, some more stretching type activities, mostly are done in kind of the supine position. So hip internal and external rotations, a hamstring stretch, single knee to chest, hip abduction, and then in a side lying position, hip extension can be done to try to gain a little bit more flexibility and range of motion. Because after healing occurs, the hip tends to stiffen up and the muscles and ligaments will be shortened. Especially if casting is done, the hip will be stiff after the casts are taken off. So we want to make sure we regain that range of motion. At the bottom of the slide, there is a YouTube video we embedded. So it's only about 4 to 5 minutes long, but it does a really good job of explaining some of these exercises so that it's not just me talking about it, so you can actually see them in action. Lastly here, so the prognosis for Perthes disease is generally non-life-threatening. The biggest issue that these kids run into is degenerative hip arthritis later in life. And the recoveries are kind of broken up into age categories too. So the younger that we can address the issue, the best outcome can be later in life. So kids under 6 usually have the best outcomes and make full recoveries. From 6 to 8, you have more moderate outcomes. So some will make full recoveries. Other will have lingering effects later. And if you catch it 8 and older, it's usually the lowest recovery rate. So these are the most likely children for degenerative hip arthritis later in life because the most damage was done and also the most invasive surgical techniques are used in these children. So that's everything on Legg, Calve, Perthes disease. Hopefully you guys gained a little bit of extra info from us, and hopefully we didn't screw anything up too bad in this presentation. So thanks, guys. We appreciate you listening to us, and we'll hopefully see you guys on campus at some point.